Hi everybody, my name is Joanne Ileto and I am the simulation manager for the simulation lab here at the School of Nursing. And welcome. I wanted to do a quick little brief tutorial on how to use the simulation lab and what you can and can't do inside of the lab. So we do have 8 rooms in this lab. One of them is a skills lab, the rest of them are all simulation labs. The rooms are all set up in the same fashion with the oxygen and everything behind the walls, the suction, the monitor, and a patient bed. The only differences would be the mannequin that's been chosen for the day of your simulation. And that could be a male or a female, it could be elderly, it could be a young adult, it could be a child, it could be a baby, depending on what simulation is being run that day. Today we're inside of the critical care room, and I want to give you a quick overview of what we have inside the rooms. Okay, here we have Susan Wheel today. She is our patient. As you can see, she's an elderly lady. She does have an ID band. Make sure all of your patients have an ID band in place. And Miss Wheel, obviously she's smoking a cigarette today. Miss Wheel, you know you shouldn't be smoking a cigarette inside of a patient room. So let's put that away. All the props, please, I expect them to be put back in the boxes or back in their cases. Put it away. I'm going to put her makeup, her stuff away. I'm going to put it inside the bag, and we're going to close the bag, okay? If you want to move anything out of the way, please put it on that counter, put it on the windowsill. Do not put it inside of the trash. These are not trash items. Any spills, anything that is as used as props do not belong in the trash because we reuse all of them. All right, getting back to the mannequins. The mannequins are fully functional. They have lung sounds, heart sounds, breath sounds. You also can get your bowel sounds, okay, using a stethoscope. You can get your pulses, okay, by feeling for your pulses. Once you correctly identify the pulse rate, you're going to get a nice pulse, or maybe not, depending on what's going on in your scenario, okay? And we get to see that you correctly found the anatomical site for that pulse. Other things that we can do with the mannequins, we can take blood pressure. It can be manual with the blood pressure cuff on the wall, or you can use our electronic on the monitor. If you want to repeat the blood pressure, it's simply touching the start-stop button. It will start to recycle. You will see no number show up here. Please don't keep pressing the button because all it's doing is resetting it to restart. It's not going to get your blood pressure any faster. If we need to do any adjustment on the monitor, is simply just touching what you want to adjust on the monitor, and you can adjust it according to what you need. Another thing to know, right? Like I said, here she's got props. She's got an iPhone. Let's give her back her iPhone, right? There you go, Miss Wheel. She has an IV, and in her arm, okay, is connected to a 3-way stopcock. Please do not remove the dressings from her arm. Her IV is connected to the port. She has a bag behind the bag. It is a collection bag. It's not meant to fool you. It's not meant to be hung on a pole. Just please tuck it behind her pillow again and leave it there because it's collecting the fluid. We do have the IV pumps, okay? Same way you would do the setup of an IV pump in the hospital, same way you would do the setup here. If you have any issues with setting up the pump, you're more than welcome to come to the skills lab and practice this. How to set up a pump and how to do the tubing and so forth. It's in the lab. It's here for your practice, for your use. Okay? All we ask is that you do please treat the equipment gently. Other things about what you can use inside the sim lab is, like I said, we have the oxygen. Oxygen is simply by dialing up the oxygen to get the right oxygen level. You can have suction. You have all of your oxygen tubing over here. You have your non-rebreather. You have your nasal cannulars. You have your venti mask, you have your Yankauer, you have suction catheters, you have the tubing for your suction canisters set up as well over there. Your mannequin's beds work. They go up, they go down, right? The mannequin can go to the head of the bed. Whatever you need to do with the mannequin, you can do here. They also have the brake and everything on the bed that you guys can use to prevent the bed from moving. Should you need any items such as IV fluids, needles, syringes, any of those items, we have all of them on the cards, and they're going to be ready for your use when you come to the room, because we figure out what's needed for the simulation and we make sure that you have it. Mind you that in the hospital setting we do not have medication cards anymore. However, in the simulation lab we do have the medications in the medication card with the names labeled on the card. So just make sure you look for your patient's name. All your medications will be in here. Whether they're the right medications or not is going to be up to you to make sure you use your critical thinking to know what needs to be given according to your medication orders, okay? As far as narcotics go, narcotics are kept in the Omnicell, which we have an Omnicell in the ER, and we also have an Omnicell in the medication room located next to the skills lab on the med-surg side of the simulation lab. Other things I'd like you guys to know and be very aware of is that we do have a sharps container on the wall here. Any sharps that needs to be discarded goes inside of the sharps container. Please do not put paper, do not put wrappers, garbage, napkins, alcohol swabs, alcohol wrapper swab, alcohol swab wrappers inside of the sharps container. It is strictly for sharps. The other thing we have is the soiled linen. If you have soiled linen, it goes inside the soiled linen container. If you have trash, right, the trash goes in the trash receptacle. If you have bloody gauze or items that need to be discarded, such as an empty blood bank bag, right, that goes inside of a red container. That is the same way we practice it in the simulation lab. We practice that inside of the hospital. Also things such as your IV fluids, any dressings that you may need, any sterile gloves. If there's a code that is being run with the case, it's in here as well. If you need to use the phone, here's the phone. All the phones, all the rooms have a phone on the wall. Just dial the number. This one for our physician would be 82443. If you needed to call a code or a rapid response, you would use the same number as well. For your gloves, your Purell, your sandy wipes are on the wall. Your linen cart will be available to you, whatever linen you may need. In the event that you need some items such as a bedpan or bathing supplies, will be in the drawers, located in the drawers for you. And should we have items missing, please just ask. We'll be more than willing to get them and help you out. Now, things that I want you to remember and to know. The mannequins, while you can give injections to the mannequin, you can give a sub-Q injection if we set up the abdomen. You could also give IV, an IV push, IV piggyback through the IV lines. You cannot give oral medications to the mannequins. The mannequins are allergic to food. So they're allergic to water, food, drinks. They're allergic to ink, especially ink as well, because the ink stains the mannequin and we cannot get it off. So if you need to write in the simulation lab, you need to bring in a pencil. If you do not have a pencil, we can give you a pencil. The other thing is, no food or drinks are allowed in the labs, okay? Just as you cannot bring your food and your drinks inside of a patient's room, you cannot bring it inside the simulation room as well, okay? The mannequins, you put the mannequins at risk. The mannequins are begging you, please do not damage me, okay? So keeping that in mind, again, no medications in my mannequin's mouth. You're more than welcome to crush it, score it, dilute it, whatever it is it takes that you need to do to make this medication work, fine. It's just coming up to the mannequin, say, here, Miss Wheel, I have your medication, and you verbalize giving the medication. I repeat, verbalize. Do not put it in the mannequin's mouth. They cannot swallow. That being said, like I said, we'll make sure all the supplies are here, and if you don't have something, please don't hesitate to ask us for it. We are just a window away. I'm always available if you have questions for me. If you have questions for your instructors, I'm sure they'll be more than happy to answer. And if they can't, they'll find out the answer for you. The only thing I'm asking you guys for is please respect the mannequins, respect yourselves, respect your fellow students, respect your faculty members, and of course us as well. Understanding that in the real world, patients may get a little nasty, and we as simulators like to have a little bit of fun. Our instructors, which is Instructor Todd, Instructor Sharu, Instructor Teresa, and I as well, who will run simulations with you guys. We sometimes get a little playful. We like to bring in real life experiences that we've experienced as well into the simulation, so that you guys can learn to deal with it as well, because it's not all roses in nursing. Okay? So, with that being said, we are video recording the simulations. We will do a playback. It is strictly for, hey, what went right? What went wrong? How can we fix this so it doesn't happen in a patient setting? So I want you guys to enjoy yourselves. I want this to be a fun learning environment. I want you to be safe, respectful, and for all of you guys who have I've been there, done that, seen that, know how to do that, great. I applaud you. Kudos to you that you know how to do it. So you're at that level of see one, do one, teach one. So if you know it, then teach it. Okay? Other than that, I look forward to seeing you guys all in the lab. We're gonna have a great time today. Don't be nervous. This is a fun learning time. If the mannequin dies, not a problem. We'll get her back up and kicking again. Can't do that with the patients though. So this is the best place to learn. All right? And yeah, let's get out there. I'll see you in the lab. Bye.